But I'm going to divert from my slides quite a bit today because much of what is in them has already been touched on, and I think there's some bigger policy issues here that need to be addressed. And so let me first, though, just talk about a few of the approaches that Partners in Health takes and why I'm up here on a water panel, because I am not a water engineer or a WASH expert whatsoever. We really try to take a full view of health, which I think everyone has referred to in their presentations. And we realized early on that even setting up a clinic in the middle of nowhere in rural Haiti without addressing some of the underlying issues of poverty was not going to make much of a difference. And so we immediately began working on water projects and food projects and housing projects and making sure that that was an entire package of care that we were helping provide. Now, we're also called Partners in Health because we know that we're not experts in everything in the world, and so we try very hard to bring in partners to work on some of these issues that we're not experts in, including water. We have a very community-based model. We employ over 2,000 community health workers in Haiti alone, close to 10,000 around the world. And they are the backbone of our project, from referring patients in to finding sites that need water to referring in specific communities or families that are having nutritional issues, and also doing directly observed therapy for all of our patients on HIV and TB treatment, and now more and more in community, in chronic disease. And I just wanted to point out that that's a very important feature of the way that we work, and without these community health workers, we would not be nearly as successful as we are. And this just is an example of the systems of community health workers that we're setting up, which is a new approach for us, but an old approach in public health, which is that we now have one community health worker for 50 households, and they're doing monthly visits as well as daily visits for those who are getting DOT or have other health issues in their household. And then this just also shows nutrition projects that we're involved in, and that this, as I mentioned at the beginning, is something that we pay a lot of attention to, as well as housing, as I mentioned, education, water and sanitation, and job creation. And so these are just pictures of the specific water projects that we've been doing in Haiti and Rwanda and Malawi. And because I'm not an expert, I'm not going to spend any time on them. And I think we've already talked about them. They're almost all community-based initiatives. Communities have taken charge excuse me, of the projects themselves and are helping maintain the spring caps or the boreholes. But we also try very hard to integrate them into the Ministry of Public Works overall systems, so that we're trying to strengthen the state system of water provision as well. We are making biosand filters, cement biosand filters in Haiti. We're not doing it anywhere else, but we were doing this especially for the women who were treating with HIV who have infants. And we had, until the recent evidence came out about using triple therapy to treat HIV in infants and mothers, we were trying to promote infant formula feeding for the infants, and making sure that women had access to clean water so that we didn't increase any incidence of diarrheal disease through that. And then we also have latrines. And in Malawi, we've also been helping with building wells and latrines. And in Rwanda, the same, spring caps, boreholes, et cetera. Partners in Health really is about 90 to 95% service-oriented, which means that that amount of our resources and that amount of our attention actually goes to providing health care. The other stuff, advocacy, training, research, is still a very small percentage of what we do. But it's an important part of what we do, and so I just wanted to touch on a couple points. One, we did do a water report, and I have just a couple copies with me, but you can find it on the web, about some Inter-American Development Bank loans that were blocked in the earlier part of the century to Haiti for political reasons by the United States, leading up to 10 years after the fact, some of these projects not actually being implemented yet in Haiti, in a town right next to Cap Haitian. So it's good to see the Cap Haitian water situation. But it just really shows how politicized these projects can be, and how politicized water itself can be if it's not just community versus versus community, household versus household, or country versus country. There's real international politics that can influence people's access to water. Two other points I want to make, and then I'm going to close with a video from some of the camps in Port-au-Prince showing some of the conditions there still, is that based on, I'm glad I came this morning so I could hear some of the discussion going on. I worry about sometimes in our own approach, where I was just showing you our community-based projects that the communities are helping maintain, but I think the question came up this morning about bigger infrastructure issues and bigger projects and how do we scale things up at a national level. And I think I worry that the same as we fall into with health and in food security issues, and we also fall into it with water, is that we do get very focused on micro, simple, cheap solutions, and we're not looking at the bigger, broader picture of setting up big public systems that can be maintained. All of our countries that the vast majority of us are from, and the reason why we're able to brush our teeth in the morning safely in New York City and Boston and LA is because we have incredibly well-maintained public systems that we pay minimally for, and that our government support and that our taxes support. And I think this is something we need to be looking at a broader picture for all of the countries in which we work. And how can some of the smaller community projects that we're developing build into a larger public system? Privatization, there's space for public-private cooperation, but I think in almost every country where private systems have been set up, we've seen rates go up so high that most people can't, especially the poor, cannot afford them. They also are not well maintained. We've had problems in the United States. Scotland's had problems. Several different countries around Brazil, several different countries around the world have had serious problems with private water systems. And I think we also need to keep that in mind when we're looking at either big large-scale programs, but also smaller-scale ones. And I think that's about the last point I wanted to make. Only that, just to finish that point, and to put a human rights framework around this, since we're here at the UN, the government of a country is the ultimate guarantor of its citizens' rights. So if another country is impeding that government's ability to fulfill its own citizens' rights, or the government itself does not have the ability to fulfill its own citizens' human rights, there are problems. And I think that's why we at Partners in Health, through healthcare, but also through now water initiatives and food security initiatives that we've been involved in, are trying very hard to strengthen the local governments and the national government's abilities to fulfill their own citizens' human rights. And this is also a picture from the hurricanes, not from post-earthquake in Haiti, where some of our social workers were going out to meet some of our patients. And that's really the view that we take at Partners in Health, is that whatever it takes is what we need to do in order to serve our patients and the people we're working with. So with that, let me show a video from one of the spontaneous camps, a couple actually of the spontaneous camps in Haiti. It's 3 weeks old, but the last I heard at the end of last week, these camps are still in this situation. So we know that hundreds and hundreds of millions of dollars have been poured in for the immediate relief effort, the monies especially that are supposed to be being spent in the first 6 months to help with water and sanitation. But this clearly shows that this is not the case in some pockets of Haiti.